May 21st, 2026. I'm Dr. Deukmedjian. Our patient travels to Deuk Spine Institute from Mississippi. She's here with her family, her husband and daughter. She's had back pain now going on 20 years. And her back pain is in two places. Here, where the L4-5, L5-S1 disc injuries are. She has herniations. And she has severe pain right where that mark is, in her right buttock. That's going to be a piriformis problem. So we're going to fix both today. But the first thing we're going to do is fix the disc pain at L4-5, L5-S1 through a left approach. So while we're doing this, why don't you folks watch our video on how disc injuries cause back pain. How do disc injuries cause back pain?
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
We've just made a 7mm or 1/4 inch incision on her back. We're going to do her entire back surgery through that incision. 1/4 inch, the size of a Band-Aid shot. Now, how does the surgery work? It works by first starting out placing what are called spinal needles. I'm placing these needles exactly where I want them in the tear in the back of the disc at L4-5 and L5-S1. Okay? You can actually see the herniation right there on the x-ray. Show them the herniation. I'm not in yet. Right there. You guys see that herniation? That herniation is a result of a tear in the back of her disc. That tear allowed pieces of nucleus to come out and get stuck in the tear as well as cause a herniation. That's where her back pain's coming from primarily. The second source of back pain is her piriformis muscle. So we're going to fix the discs first, which are causing back pain, and then we're going to fix her piriformis muscle.
Don't move. Open your eyes for me.
Open your eyes. Everything's okay. You're in surgery.
Hey, can you open your eyes? Good. We're going to ask you a question. You have any
Now our patients, when we do this surgery, they're awake for just a few minutes while we test the two discs to make sure they are causing her pain. You have any questions?
No questions.
It's the actual tear in the annulus, that's what I'm showing you with this wave, that allows fragments of nucleus to get stuck in the tear and bulge out. It's not pinching of the nerves going down her legs that cause the back pain. Back pain comes from inflammation in the tear. That's what I discovered here at Deuk Spine. I'm Dr. Deukmedjian, the founder at Deuk Spine and the one who figured out where back pain comes from. And we've been actually fixing it for 20 years at Deuk Spine because we're going in and treating the tear with a laser, debriding it. All right, Dr. B, are we almost ready?
Can you open your eyes for me? Good. Don't move, okay? Don't move your arms.
Lay still.
Can you open your eyes? Are you having any back pain? No or yes?
No. I heard her say no. All right, so we're just going to give her one more minute while I talk to the audience. Folks, there are 30 different causes of back pain, 30 possible causes. And we have identified 1, 2, 3, okay? We're going to fix these 3 today. We're going to get rid of the back pain that she has. But other people have different sources. They may have disc, they may have facet, they may have SI joint or piriformis. In her case, she has 2 discs and a piriformis, okay? We're going to fix the disc first, then we're going to stop the stream and come back and do the piriformis. Are you having any pain right now?
Are you having any pain right now? No.
All right. The only test in the world that tells a doctor if a disc is the cause of somebody's pain is called a discogram. Okay, discogram. We're going to do a discogram in just a few minutes. It's called an evocative discogram. You can look it up. You're evoking a response. Are you having any pain?
Are you having pain right now? No.
All right, that's good.
You're doing great.
How bad is that on a scale of 1 to 10? How high?
Give us a number.
What's the highest it went? 10. I heard you.
She just said.
And is that where you get your back pain? That's where that pain's going to be gone when you wake up. Isn't that great? You're doing great. Just relax. We just relax. We just tested the disc to see if it's causing pain. You did fantastic. What's that? I couldn't hear what she said.
What'd you say? Is that a cat? Okay, we're good. You having any pain right now?
All right.
Your nose.
You want to scratch your nose? Go ahead. Oh, go ahead and help her. Scratch your nose for her. Gently. All right. Is that better? All right. Are you having any pain? All right. How bad is that on a scale of 1 to 10? What's the highest it went? All right. Is that where you get your pain? Yes? All right. You get to go to sleep. When you wake up, that pain will be gone. So, folks, the only test in the world that you can verify that the disc herniation is indeed causing the patient's pain is called an evocative discogram. We just did that. And we just found that each of these two discs is causing 10 out of 10 pain. And it's concordant, meaning that's the pain she gets every day. It's not just some pain that I created by doing surgery on her. You're okay. That's medicine going in your vein, that's all. You're doing great. I want you to count out loud from 1 to 100. She asleep? Sleep? All right, she's back asleep. We're going to put a little little numbing medicine in there just to numb up the fascia, because fascia does have pain fibers. Let me know if I can proceed. We're going to start at L5-S1. Shot? Thank you, Jordan. We are now at the L5-S1 disc. Now we're going to enter the disc through the herniation and tear in the back of the disc. That way we don't do any additional damage to her disc. We're going to go right in through the tear. I've just entered the L5-S1 disc on the left side through the tear that was already there. That's the tear that's causing all of her pain at the L5-S1 level. We're going to clean that tear up right now using a laser and an endoscope. Go ahead. Shot. So we got the dilator out. What's left is our tube. And we're going to do the entire surgery through a 7 millimeter or 1/4 inch tube right there. There's no need to open her back up like other doctors do. There's no need to do laminectomy and take the normal bones out of her spine. There's no need to take ligaments out that are good ligaments that are working, helping keep her spine together and stable like other doctors do. We are going to leave all of that alone. The only thing we're cutting is her skin, and that will heal very easily within a few days. So this whole surgery is being done without doing any damage internally. And because there's no internal damage, patients don't have any pain afterwards. So they literally go home an hour after the surgery and don't take pain meds. We don't give any of our patients narcotics because they don't need it. Any questions?
No questions.
All right, in that case, let's show the audience the 30 different causes of back pain that cause chronic back pain. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. You can see from our video that the disc injuries like herniated disc, bulging disc, ruptured disc, protruded disc, slip disc, disc bulge, disc herniation, those are the #1 cause of back pain. And the way they cause back pain is through inflammation. So we are removing that source of inflammation right now at L5-S1 to get rid of their back pain. The second most common cause of back pain is probably the piriformis muscle. You know, we originally thought it was the facet joints, but it looks like it's the piriformis, because piriformis is far more common than facets. I think that it's just underdiagnosed by doctors. They don't know how to diagnose it, so they don't diagnose it. People live with it, and they live horribly with it. This patient has piriformis pain. We're going to fix that for her. All right, Anthony, let's show the audience how it is that disc injuries cause back pain.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Case cover or something. Welcome back. We're just finishing up L5-S1 laser spine surgery. The laser fiber is at 12 o'clock. You can see it. It looks like a glass fiber. We use it to remove the herniation. We use it to remove the scar tissue and inflammatory tissue that's down here around the disc. This stuff here is all herniation. This is where her pain is coming from. And we've done a good job of cleaning it out. Now that laser fiber is 1 millimeter in diameter. So 1 millimeter, that's the glass part right there. The plastic over the glass adds additional width to it. But the actual laser fiber is only 1 millimeter. And that's transmits energy from a laser machine that we have here in this operating room. You can't see it, but it's down by the patient's feet. It's the size of a large suitcase. And that machine is over $100,000 machine. Nowadays, the new ones sell for $200,000. That machine puts out a medical grade laser energy, laser beam, which we use that energy to remove bad tissue around the disc tear, the annular tear. We call it a debridement of the tear, removing calcium deposit, herniated nucleus, scar tissue, abnormal nerve bundles and blood vessels, inflammatory tissue, granulation tissue, bone spurs. So the laser can remove all those things and clean out the tear, which then allows the patient's body to heal the disc. You cannot heal a disc herniation without debriding the tear first. That's one of the most common things people make a mistake. They believe, well, if I give my herniation long enough time, it's going to heal itself. You hear that on the internet, you hear it on Facebook, you hear it on YouTube. It is not true. Disc herniations never heal themselves. Never. I have never seen a disc herniation heal itself. And I've seen more herniated disc than pretty much any other doctor out there, except for one, Dr. Anthony Young, who, before he retired, he was my mentor for endoscopic lumbar surgery. And he had done, he said 10,000 cases, okay, in his career. That's a lot. I'm at almost 3,000 cases. So he said he had done 10,000. I don't know. I wonder about that 10,000 number, though. I like Dr. Young a lot. But he sometimes exaggerates things a little bit. That said, he had around, well, at least 5,000 cases, maybe more. He's seen more discs than me, disc herniations than me. But that's the only person in the world that has seen more disc herniations from inside the disc herniation than I have. And so once you've seen as many as I've seen and Dr. Young's seen, you realize there's no way this thing's going to heal itself. It may become less painful at times, but that doesn't mean it's healed. Okay? It just means it's less painful. We have other situations in medicine like this. For example, if you fracture your bone, okay, and it doesn't heal properly, then it's not going to heal properly. Now that's the inflammatory tissue right there. You see the pink color? That's what we're here to remove. That inflammatory tissue is what causes all the pain. Like a pimple in the back of the disc. Any questions?
No questions.
Boy, Anthony, you got to get more questions going.
Hey, we still have some time.
No, I just mean in general. You got to do a little searching. How do you get more engagement? How many viewers do you have? I just think you don't have a lot of viewers.
We have 13 at the moment.
13. Yeah, 13 is not a lot. The world has 1 billion people with chronic back pain, and we have 13 of them watching. And I don't not appreciate my 13. Very happy you're here. But we got to get the word out. I don't think anyone else creates content like we do that's as educational, informative, helpful, useful, trustworthy, truthful as we have. So where are the other 999,999,000 yeah, 987 people with back pain and their family members, right? Anthony.
Yes. We have one more person.
Get on it.
Yeah.
Get on it, buddy. You can do this. All right. Any of our viewers have questions about what we're doing, why we're doing it? We showed them the 30 causes of chronic back pain, right?
Yes, we have.
We've shown them how disc injuries cause back pain.
Yes, we have.
Now let's show them how we fix these disc injuries using the laser endoscopically.
Okay.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 34969.
Our animation that we use the laser to clean the tear where all the pain is coming from. That's the tear. You guys are looking at it right there. The laser is inside the tear. It's zapping away the herniation. It's zapping away the calcification and granulation, alleviating pain. All right, I understand we do have a question from our audience. Let's take the question.
Yes, we have a question from King Solomon on YouTube.
King Solomon. Very nice. Welcome.
What is this process going on right now? I just tuned in.
Well, King, this is a patient who has suffered with back pain for 20 years. She's young. She's in her 40s, I believe. And she travels to Florida from Mississippi with her family because she came here for this particular surgery. Her back pain is coming from two damaged discs. We call them herniated discs. She has a tear in the back of the disc in the wall or ligament that holds the bones together. And that tear is allowing the jelly inside to seep out and get stuck in the torn ligament. Once the jelly gets stuck in the torn ligament, her body does its best to try to clean it up through a process called, we're done, called inflammation. Okay? And we're going in here and cleaning out the inflammation. And we're cleaning out the herniation that causes the inflammation. So that's what we're doing. The procedure is called the Deuk laser disc repair. It's been around for 20 years. You probably haven't heard of it because most surgeons don't know how to do this surgery. It's more advanced than what they've been trained to do. It's an advanced technology. That said, it is curative. It literally cures people's back pain. Gets rid of it permanently with one treatment, one surgery. And it's all done through a 1/4-inch incision. You see this incision right here? That's it. A Band-Aid incision fixes that pain that she's had for 21 years. That's why she came here. And that's what we've been doing, cleaning that tear. Thanks for joining us. We'll be back shortly for a piriformis release.